Public Safety family. It's me, Jason Carp, Esquire from the Public Safety Network, here to provide you the news of the day. That is our nod to public safety. News of the day from the Public Safety Network. Give me 3-4 minutes maybe, and I'm going to blow your mind. So let's get into it and to see what's going on. So we're going to focus a little bit on some of the health issues going on in public safety today. Got some unfortunate news out of Converse, Texas. Fire Captain Brian Anderson, a 16-year veteran, passed away from COVID this past week. Very, very sad. Our heart goes out there. I wanted to raise this issue or highlight this issue because first responders and those on the front line are still being affected by this virus every single day. And it's so critical for us to continue to follow procedures, wear our PPE, and take all the steps that are necessary to protect ourselves and the public. I know that in New York City, for example, 11 members of the NY Fire Department have also passed away from COVID, 4 of which were EMTs. This hasn't gone away, and it's still an issue. And although we're talking about a lot of other issues going on with police budgets and protests and the election, and we are still smack dab in the middle of this pandemic, so everybody needs to stay safe. What else is going on? I can tell you that New York's having its difficulties just like others. The New York Union for Emergency Medical Services has indicated that the city of New York is looking at potentially laying off upwards of 400 emergency medical service providers, 400 EMTs and paramedics throughout the city. That's a lot, and that's a concern. But they've got a more than $7 billion budget shortfall due to the pandemic. Apparently, this is impacting all of the different agencies. But of course, these folks are on the front line trying to keep us safe. It's more important than ever that we have the resources to do that. New York's been receiving a record number of calls for EMS every day, 6,500 every single day, 6,500. That's more than they've had since 9/11. So absolutely critical. These budget cuts are having real impacts to these cities, and our frontline public safety and professionals are being impacted. So really important to work with your local city, county governments and take whatever steps are necessary to ensure that you're maintaining the kind of resources that you need in order to keep yourself safe and keep our communities as safe as possible. But this is a challenge that we're all facing around the country. On a good news within the healthcare area, what we are seeing on the rise is the concept of hospital at home. This kind of expands the concept of telemedicine by actually setting up a hospital situation at home for non-acute patients, with heart disease, diabetes, other afflictions, where they have remote monitoring equipment and technology and communications equipment so that they can be monitored all day long. Medical professionals coming and visiting them throughout the day, and these patients actually have emergency buttons at home. What they're finding is that the patients are happier, they're having better outcomes, and it's cheaper to provide services to them. In fact, one study, or I should say 2 studies really, out of Cincinnati and Honolulu showed respectively 29% and 38% reduction in costs with the home hospital program. So, kind of a win-win across the board in terms of remote medical care, but there are some challenges, and those challenges are how do you pay for it? And historically, it's been a problem because these services weren't covered by Medicare, Medicaid, and private insurance. Now, good news is CMS, Centers for Medicare and Medicaid Services, has, at least temporarily during the pandemic, allowed for reimbursement of remote care services, such as hospital at home. However, that's temporary. So, and similarly with private insurers, they are covering some of this, but and I know, that ain't going to continue. okay, unless it makes sense and it's financially sustainable for these organizations. So critical that there is federal legislation that's passed, that these programs are extended permanently to allow for things like ET3 and for telemedicine and remote care. It just makes all the sense in the world, and to ensure that these services can be appropriately reimbursed. When you're seeing better outcomes, and it's cheaper to provide the services. There's a number of providers doing this out there, and I think it's worth a mention because I find this really interesting. So a company called Medical Home is doing this. I think they're in 12 different states, and they're working with several different hospitals, also out of Nashville area. You've got Contessa Health, which is got 14 hospitals and working out of 6 states, and they're expanding their operations. They've indicated a 140% increase in use of hospital at home services since last year. Similarly, there's a company called Dispatch Health, and this gets more into the ET3 side, where they have historically focused on sending out EMTs to help patients administer medicine, to check on them, diagnostic care, and other things. They are now piloting, and have been piloting since November, a home hospital solution, and plan on expanding that program. So you're seeing a lot of companies involved in partnering with hospitals and agencies to offer these remote services. And now that we have the technology to do this, we have communications where you can communicate and send vitals from wherever you are. Companies like Allerio and others who are providing communication solutions. And you've got workflow management solutions like Pulsara. So there are companies out there, and there's technology out there that completely enables the ability to provide top-notch care from remote locations. And some hospital systems are doing this themselves. So you've got Atrium Health System out of the Carolinas and Georgia. They've got a program with 36 hospitals. Of course, you've got Mount Sinai out of New York, and they've seen a 200% increase in the last year of use of the services over what they have traditionally. So very exciting stuff that I think can help keep all of us safer, certainly during this pandemic, achieve happier and healthier patients. I mean, think about being at home and being in your own bed and be able to eat your own food and be able to take walks and be surrounded by people you know and who love and are taking care of you in familiar surroundings. That in itself, the psychological impacts of that, as we know, can have very positive impacts on physical outcomes. And it costs less. So this is very positive for us in public safety, in healthcare, and in technology. So I urge everyone out there to be talking with their supervisors, their cities, the federal government, with CMS, all of the folks necessary to extend the kind of coverage necessary to enable these services going forward on a permanent basis. Anyway, with that, I'm going to let you go. It's been a pleasure, as always, serving the public safety community and giving you the update on the latest news on PSN News of the Day, our nod to public safety. I am out of here. Take care.